this is the Bayesian network application that I mentioned at the top end. It's a case study where we had a client, large pharma, IO asset, and renal cell carcinoma. They're going through the clinical development. They observed that there were heterogeneous patient responses. Some patients were doing much better than others. We typically go in with the average treatment effect when you're looking at efficacy and safety outcomes, but sometimes that underestimates the value of your asset. So the challenge for us was to come up with a marginal treatment effect construct. And what we did was to come up with an individualized or personalized risk prediction model using the Bayesian network technique. The paper has been published, I think it's Journal of Clinical Oncology. You can find it and get into the details of it. But the top line here, again, coming to the output, the DAG that you see, it shows the interdependencies in the various variables. We are also able to identify the variables that best predict the outcomes of interest. So in this case, it was the risk scores, Memorial Sloan Kettering scores and Heng scores, biomarkers, as well as some of the performance status indicators. We're able to use that to identify best response, i.e. patients who are likely to hit certain thresholds of outcomes. And that's the level of detail that you can get into when you're using some of our machine learning techniques to move away from average sort of broad patient level results to the individualized, let's account for their respective baseline characteristics kind of construct.